For those of you who don't know me, I'm Ed Keable. I'm the superintendent at the Grand Canyon National Park. I want to welcome you to the session of the Grand Canyon Historical Symposium. Last night, Tom Meyer talked about a network of people who work in this park to keep residents and visitors safe. One of the components of that network is the U.S. Public Health Service. The Public Health Service has had a really great relationship with the National Park Service for over 100 years. So Jonathan, when you spoke earlier of how do you define history, it's at least longer than anybody here who's alive. I think the U.S. Public Health Service and Park Service relationship qualifies as history. And I just want to say that as superintendent, I rely on the Public Health Service a great deal to manage this park. And I'll just give you one example. When I got to the park as superintendent in May of 2020, this park had been closed for a month because of the COVID-19 pandemic. And that's important for a number of reasons. One, we weren't fulfilling part of our mission, which is to make this natural resource available to our visitors. But also, as a practical matter, the Grand Canyon's budget relies on fees that we collect from visitors. 80% of our budget comes from fees, so we weren't collecting fees for a month. On my second day in the park, I had to cut $5 million in our budget because we hadn't collected money for that month. So welcome to the Grand Canyon. So I had to ask myself, is this sustainable? And what can I do about it? So I turned to the Public Health Service officer appointed to the Grand Canyon and started asking him questions about the pandemic and operations during the pandemic. And with his advice, I was able to formulate a plan to quickly reopen the park. And so we were open within a week of me coming here. And that decision was founded on sound science as presented to me by the U.S. Public Health Service. So that's just one example of many of how the Public Health Service supports national parks and has supported me as superintendent. So I am proud of the relationship that we have and pleased to introduce Lieutenant Commander Ronan King, who is my Public Health Service and provides advice to all Arizona parks. And Ronan will introduce a film that talks about that relationship between the Public Health Service and the National Park Service in part, and some other things, great things the Public Health Service does. So with that, let me introduce Lieutenant Commander Ronan King.
Thank you, Superintendent Keable, for the kindest words. Just the idea of serving in this iconic location, it is one of the greatest honors of my life, and I am proud to be able to perform public health duties for this iconic park, as well as 20 other National Park Service units throughout the state of Arizona and southern Utah. So before we even get started today, and you don't have to participate if you don't want to, but show of hands, who in this audience looked at this uniform and thought everything but Public Health Service? I'm right there with you. I almost want to jot back about 13 years in my life. During my first day on my federal career, I'm assigned to the Food and Drug Administration in South Florida. I come walking in as a 20-year-old something, and I see this man in this uniform. And 20 questions ensued. What are you doing here? Why is the military here? And through talking to him, through having an inquisitive mind, I found out about the United States Public Health Service. And I found out about some of the interesting roles that we offer throughout the country. First off, providing medical care to our indigenous communities as well as incarcerated inmates throughout our Bureau of Prisons. Another role that Public Health Service officers fulfill, ensuring those operating aircrafts are doing it safely so that we're not tiring out and causing injury to the passengers. And probably the most cool thing I found out in my research is that we have public health officers that could ride a mule down to the bottom of the Grand Canyon and do some work. It's interesting listening to Wayne's presentation a little bit earlier today and finding out how this park operated a little bit before public health. Unfortunately to present, we don't have any more blue glue toilets down in the bottom of the Grand Canyon, but I will attest to what Wayne said is that there is nothing that people in uniform love doing more than writing citations. I guarantee each and every one of you went to eat at a restaurant today, somewhere in the park. And unlike our counterparts inside the state of Arizona, we don't necessarily have a public health department here at Grand Canyon. So what happened was, with the assistance of Superintendent Keable, they recruited me. What is my role here? Well, it can range from anything to anything. Those restaurants that you inspect, I would love to homework every single one of you all. Look for that sign in there that says, this restaurant is inspected by the United States Public Health Service. So if any of you get foodborne illness, I'm definitely to blame, but fortunately, the restaurants here do an excellent job, and public health makes sure that we hold these folks to accountability. Second, in the National Park Service, we not only have visitors that arrive at our parks, but we also have a bunch of residents here. And we want to keep those residents safe as well. All of our water from the Grand Canyon comes from a source on the North Rim. It's called Roaring Spring. Well, how does it get here? Travels down and then shoots right back up. So we want to make sure that all the water that everyone is drinking is safe and sound to go. And then last but not least is we live in a natural setting. Often many of us sit here and come into a national park and think that it is adverse from risk, that we're in a safe spot, but realize we're actually in the backcountry. So my role here is to also respond to any sort of case of disease, such as norovirus on the bottom of the Grand Canyon. Those who are river rafting don't have the established facilities like we would have up here on the South Rim or the North Rim. If you want to know anything about how they have to get rid of human waste in the bottom of the Grand Canyon, we can definitely have that discussion after class, because it is not that pretty. But we do have these operations that occur, and we do want to make sure that people are sick. Prior to actually working here for the Grand Canyon, I was assigned to the CDC doing inspections aboard cruise ships. And one of the big viruses that tends to infect passengers on the cruise ships is norovirus. And putting it nicely, it's a crappy situation. When I was working for the CDC, I thought there is no place in the world worse to get a norovirus infection on a cruise ship. And then I saw the bottom of the Grand Canyon. 110 degrees, no physical facilities, and a raft that's doing this. So one of my major roles is to come into this park and assist Superintendent Keable, making sure that folks are not getting sick while they're on the bottom of the Grand Canyon or while they're on top of the rim. Today's presentation is an interesting one because it gives a history of my service, the United States Public Health Service. It's interesting, when I walk through the streets, even on Halloween, when I wore this service dress blue uniform to my coffee shop, everyone came to me, they're like, wow, you're a pilot for Halloween. That's an awesome uniform. And I had to say, no. We all have, as officers, an elevator talk where we try to tell people in that 10-second time period, what do we actually do? In huge thanks to Christopher Schuler and under the direction of Rear Admiral Pam Schweitzer, retired, we now have a documentary to explain to the world what the Public Health Service does and this important history on how we have shaped public health in our nation as the only uniformed service in the entire world dedicated to protecting and promoting the health of our citizens. This documentary hopefully will give some background on what we do and also highlight the unique role that we have in the National Park Service and specifically Grand Canyon National Park. So without further ado, I would love to present the Grand Canyon premiere of The Invisible Corps, a documentary about the United States Public Health Service. Following this documentary, I'll be up here answering any questions you might have, and also we'll have cards that will give information about this documentary, so feel free to pass it out, spread the news, and if anybody didn't get sick today, thank your public health service officer. Enjoy the documentary.
You have heard of the Army, Navy, Air Force, Marines and Coast Guard, perhaps even NOAA and the Space Force. But what uniformed service protects and promotes our nation's health?
Introducing the President of the United States. Hello, everybody. Can you hear me? Yes, good morning, sir. This is Rear Admiral Forrest Ludiak, the Acting Surgeon General, and I'm proud to introduce our team from Monrovia, led by my Acting Deputy Surgeon General, Rear Admiral Scott Giberson. Well, Scott, can you hear me over there? Yes, sir.
And I still remember looking up at the heavens and saying, you know, this is perhaps in our history the most dangerous deployment we've ever been on. Right? Going out into the field, taking care of patients for an incurable disease.
And I do recall that, I think the first 3 bodies that I saw were children. And that was about as real as it gets.
What you are doing is saving lives, but it's also protecting peace and security. And I personally am just profoundly grateful for what you're doing.
You are about to embark on a historical mission for the U.S. Public Health Service. We have been enveloped in infectious disease fights throughout our 200-plus year history. This is no different.
But it's pretty rare where you have the opportunity to save tens of thousands, potentially hundreds of thousands of lives, and at the same time protect our homeland. And it's pretty rare when we're able to do that with a small contingent of folks like you. It's also an example of what makes America exceptional, when we do what we do in ways nobody else can do. Then it creates an impression around the world of what American leadership is all about. So my main message really is just to say thank you.
These officers fight battles against invisible enemies in our country and around the world, saving millions of lives. They are the U.S. Public Health Service Commissioned Corps.
What we have is a network and a connective tissue, if you will, that keeps the public health communities together, intertwined without knowing it. And Ebola is an example because when we deployed, people heard of CDC deploying to Ebola in Africa, NIH, the National Institutes of Health, doing Ebola vaccine trials to get an Ebola vaccine. But when you get over there, you realize that the person who was leading the CDC effort was a commissioned officer. The person leading our effort, myself and a few of my colleagues, the person leading the NIH vaccine trials was a commissioned officer.
I mean, we are the only uniformed service entirely dedicated to health in the world. And when you're in a time of need, in a disaster, like a hurricane, a tornado, an earthquake, a wildfire, COVID, border crisis, the people who are going to be called are going to be the public health service to lead that response. Everyone there is a health professional, but they're also an officer as well. So their duty is to the country, and they salute and obey and go do their duty. And it's 24/7, 365.
Under the leadership of the Assistant Secretary for Health, the U.S. Surgeon General oversees the operations of the Commissioned Corps.
Because healthcare, traditional clinical care, what happens in a hospital or a clinic, only comprises about 20% of what actually makes you healthy. The other 80% of what makes you healthy are things like transportation, childcare, a job that pays a living wage, safe housing. These are all things that the Public Health Service is investing in and helping to create.
Dr. Adams, how has the role of the Surgeon General changed over time and why?
Wow, great question. So that is an entire hour. I'm going to try to condense it for you. It's changed really because of need, but it's also changed because of politics. So when I say need, if you go all the way back to 1798, President John Adams signs the Act for the Relief of Sick and Disabled Seamen.
The Marine Hospital Fund created a series of hospitals in seaports that were designed to protect and care for seamen. Politicians have always wanted to bring home funds to their communities, and also they've always wanted to put their friends in these positions. And so as a result, the Marine Hospital Fund by the mid-19th century had become fairly corrupt.
Well, in the late 1860s, Congress recognized this wasn't working out real well. They characterized many of the hospitals and healthcare areas as bastions of nepotism and patronage. And they hired a guy named John Woodworth. John was a retired U.S. Army Civil War surgeon who was brought in specifically to marshal these resources, provide the real leadership, devoid of patronage and nepotism, but to serve the country.
So in 1871, John Woodworth became the first Surgeon General of the Marine Hospital Fund, the Marine Hospital Service. And Woodworth actually wanted to transform and clean up this service. So he instituted a series of reforms, and I think the most important of these reforms was instigating an examination for physicians who would join what became the Public Health Service.
So this was the experience of 42 young physicians who arrived to become commissioned officers. After a physical exam, eliminating some, the remaining 30 began a week's ordeal of written tests. Every morning, some of their numbers were quietly dismissed. 10 remained for the oral pre-medical exam, where they were queried on their knowledge of the world, including a request to read aloud in another language. The final hurdle was clinical, where they were required to examine and diagnose 6 patients. 8 fatigued applicants completed the ordeal. 2 weeks later, 3 received letters offering them a commission in the service.
So this radically transformed what had been the Marine Hospital Fund, made it much more professionalized, also brought up a standard of care and expectation as to what a physician should know and do.
In 1889, Congress established the U.S. Public Health Service Commission Corps within the Marine Hospital Service.
And that's how the origins of the Public Health Service got started, really centered around health care, not public health, but around health care for sick and disabled seamen. Throughout the years, that mission has evolved and has grown. But also, public health became part of this. Why? Because you had the plague, because you had smallpox, because you had infectious diseases. And so it shifted from health care to really infectious disease control.
Public health is a multifaceted task. You need to have all sorts of people who are looking at the problem from a variety of different angles. Beginning in the early 20th century, they began to expand the Commission Corps to include many of these different professions, and they expand them repeatedly so that by the time you meet into the 1950s and 1960s, you have nurses, pharmacists, sanitary engineers, dentists, all scientists, a whole range of different professions in the Commission Corps.
Public Health Service officers from 11 categories have been integral to health milestones throughout U.S. history.
We tend to forget how important sanitation is in preventing disease, and one of the diseases that was really